Let's talk post-mortem care. As an ICU nurse, I've done a lot of post-mortem care, and I want to talk about kind of some of the steps that I do to prepare a patient for going down to the morgue. I'm going to throw in a little disclaimer right here because I know that this is a very sensitive topic for many people, including myself, and I'm going to do my best to be sensitive in the words that I use talking about it. However, my channel is a nursing channel, and I am a nursing educator person on TikTok. So I am going to still be talking about this in a very medical, educational way. After a patient expires or passes away, I will make sure all the family has, once they've said goodbye and they've all left, I will begin preparing the patient for going down to the morgue. I'll start off by removing any lines that may be appropriate, IVs, catheters, central lines. However, if the patient is potentially going to be an ME's case or a medical examiner's case, I will hold off from removing anything until I get either the yes, they're going to be an ME's case, or no, and then I'll go ahead with removing the lines. I'm going to do a whole other video on when a patient may be an ME's case, but for the purpose of this video, if they are not an ME's case, I will remove all of their lines. Also kind of wipe the patient down and get them as clean as possible. It's very common for patients to have bowel movements or urinate when they pass away, and so usually you're going to be cleaning up some sort of bodily fluids. This is just one example of a body bag. Usually there's just a zipper all the way from the top to the bottom. This one's nice. It's got handles on it. I've actually never seen that, which is pretty cool. But make sure you get the appropriate sized bag for your patient. If your patient is super tall or maybe they're a bit larger, make sure you're checking there should be measurements on the body bag that says like up to this height, up to this weight. You're going to want to, trust me, just check it before you put the patient in a too small a body bag. There should be some tags included in the body bag kit that you should put a patient label on, and you're going to put one on the patient's toe. You should put one on the outside of the bag and one on any patient belongings that may be going down to the morgue with the patient. There's also different biohazard tags if the patient has something that maybe we're concerned about potentially exposing other people to down in the morgue. Also, make sure you always lay chucks underneath your patient. Once the patient is all bagged up and ready to go down to the morgue, there's some paperwork I have to fill out, but then I will call our mortuary or transporter to bring this special cadaver cart to transfer the patient in the body bag onto this cart, and then this little device will actually sit on top of the cart so they can be transferred to the morgue. Now, I know not all hospitals have these things and they're kind of fancy smanchy, but this is what we have at my hospital. I hope that helps. If you have any further questions about post-mortem care or any concerns, please let me know.